观众朋友，欢迎收看本期的最佳方案。人到老年呢，生理上会发生不少变化。一个重要的变化呢，就是口腔疾病呢会越来越多，牙齿松动、掉牙，还有口腔干燥等等，使得生活质量受到了一定的影响。那么老年人该怎样保护自己的牙齿？碰到常见的牙齿疾病该怎么样进行治疗呢？这次节目非常有幸地请到了美国 UD 牙医联合企业的运营总监 George， 让他来给我们谈一谈老年人该怎样保护自己的牙齿。George 呢已经有着30年的牙医治疗经验，目前呢他是全球有着145家牙医连锁企业的 UD 牙科的美国运营总监和首席牙医。
Periodontal disease is common in seniors. Approximately, and I have some statistics, around the age of 65 years of age, 55% of the population will have periodontal disease to some extent or another. It could be around one tooth, but it's periodontal disease, and that typically spreads to other teeth. It could be the whole mouth. By the age of 75, 65% of the senior population have some periodontal disease to some extent. So it is quite common. A patient would typically tell me there are some telltale signs, and just listening to the patient, I could connect the dots and realize it's periodontal disease they're talking about. They're like, "Doctor, I used to have perfect smile. My teeth were like Hollywood. Now I have spaces in between my teeth. My teeth are shifting. When I go to a restaurant, it's embarrassing. I see food is getting stuck there. I feel it. It's a problem, shifting teeth." They'll say, "Doctor, when I brush my teeth at night, my toothbrush is pink. I spit blood in the sink. What's that all about?" Another sign of periodontal disease. "Doctor," they'll say, "I brush my teeth. 15 minutes later, I have a bad taste in my mouth, like I didn't brush my teeth, a rotten taste. Now I'm running out buying gum, buying mints, buying drops, cough drops, things of that nature to mask the odor. It's embarrassing." So those are telltale signs. One last telltale sign is, and this deals with root caries, is receding gums. It's an expression that's used to describe older people. They're long in the tooth. It's an American expression, I guess. The gums recede, so the teeth appear longer. As the gums recede, the root is exposing the tooth decay, which we'll talk about, but also sensitivities. They're like, "Doctor, my teeth were never sensitive. I can't forget ice cream. I can't even have cold water, and then it stings, and it's painful to me." Another sign of periodontal disease. Periodontal disease is a disease where the plaque bacteria, these are the causes of it, then we'll get to a little bit of prevention, where the plaque bacteria causes the gums to pull away, to detach from the teeth, and I will show you a picture in a minute, causing a pocket. That pocket gets filled, periodontal pocket, which is measured with little devices, little rulers. We all have the periodontal probe in our mouth, gets filled with plaque and food. And again, the pocket gets a little bit deeper, keeps getting deeper. As it gets deeper, you're less able to keep it clean at home. So it comes as a vicious cycle as time goes on. Eventually, it's going to start pulling away the bone that holds up the teeth, that anchors the teeth, thus the shifting of the teeth and the loosening of the teeth. Periodontal disease, the good news is it can be prevented. Regular checkups for the dentist, and again, this is a repeating story. Good oral hygiene at home, a healthy diet and lifestyle. That's how you prevent periodontal disease. The bad news of periodontal disease, there's really no cure for it. The flip side of that is there are treatments for it. Again, you go to your dentist, they could do deep cleanings called root planings or curatages, where they might have to numb you up for it, go below the gum line into the pockets to remove plaque, calculus, which is also known as tartar, which I'll explain in a little bit, and also diseased tissue. So they could do root planing, and there are surgeries out there. There are soft tissue surgeries, which they can cut away the pocket surgically, and there are also bone grafting surgeries, where you could fill those where the bone once was, you could fill it back with natural or artificial bones. And there's also medications. For daily use, there's antimicrobial mouth rinses that will kill bacteria very effectively, much more effective than cosmetic mouthwashes that are more over the counter. These are prescription drugs now. So they're not for the family to use, not for children to use. This is for someone with periodontal disease. But they're mouth rinses that will prevent those periodontal flare-ups. It'll keep the disease in check. Nowadays, and there's a lot of studies going into this, the mouth is in fact connected. Periodontal disease, keeping things simple, because this is kind of complicated, is an inflammatory reaction. And this inflammatory reaction, the toxins produced by it go elsewhere in the body. It is a direct correlation, and the evidence is solid. People with active periodontal disease are at greater risk of heart disease, especially myocardial infarctions, especially the heart disease where the patient suddenly dies. Okay, it's breaking up tissues in the mouth. Why not break up heart tissue? The same goes with the brain. People with periodontal disease are more apt to have strokes. People with periodontal disease and diabetes is very prominent in the geriatric population, the person with diabetes will have more difficulty to control it with periodontal disease. So periodontal disease, there is an oral systemic connection. So it's very important that you treat periodontal disease early on. You can see in this picture inflamed gums, the plaque along the gum line. Plaque like to hide along the gum line, in between the teeth. Flossing we're going to talk about, that's in between the teeth. Brushing properly along the gum line to clean that out. And the gums are angry. You can see they're angry and they're rolling backwards. This is a schematic of periodontal disease. The one side, the right side, it's healthy. The bone levels are high. The gums are nice and pink. On the other side, the gums are red and angry, and the bone has detached. And you can see the tartar and the plaque over there, and it's forming that pocket. The bone is being eaten away and pushing downward. This is just another visual of what periodontal disease does. You can see here, this is that ruler that the dentist uses. We've all had this. It's a ruler, nothing more, the periodontal probe. It measures the extent of bone loss and the condition of the gums. Here is normal, roughly 2 millimeters. That's very cleansable. You can do that at home. But once you get beyond 5 millimeters, like you see here, the bone is down. It's very, very difficult to clean that at home. It's impossible, to be honest with you. So that'll become quickly the 7 millimeter pocket, the 8 millimeter pocket. The disease just keeps building upon itself. And these are x-rays over here. Healthy bone levels on the right side, and you can see obviously the bone is much lower on the left side. Beyond it, this is severe bone loss. These teeth are moving. These are mobile teeth, so when the patient goes to bite, these teeth are going to hurt. They're not going to eat, things of that nature. Root caries is a problem. It's a problem for the patient. Believe it or not, it's a problem for the dentist as well. It's very, very prominent. I jotted down a statistic. At the age of 75, 50% of the population will have at least one carious lesion, it's getting technical, on the root surface of the tooth. The root surface of the tooth is not covered by enamel. Enamel, again, the hardest substance of the body, that's the whites that you see here. It's not covered, so it's covered by dentin, which is much softer. So, and I've seen this personally. The caries progress very rapidly. I've said goodbye to a patient, I'll see you in 6 months. 6 months, lo and behold, they'll have 3 root caries in one particular area. It's almost a mystery to me. They're not brushing one area in particular for whatever the reason, but all of a sudden they're there. And 6 months ago, they were not there. It progresses very, very rapidly. They're technically challenging too. The reasons for root caries is kind of many. As we age, we have less saliva. Saliva does prevent tooth decay. As we age, we may not be able to practice the proper oral hygiene that we once did. This is someone who's lost teeth. Not pretty, and you could see areas, and I'll point, where the bone has now caved in a little bit. That's atrophy in one area. It's very difficult to see on this slide. In the back, you can see the jawbone almost like scooped out. And that jawbone in the back cannot support a denture the way it is. If they make a denture, it's not going to fit right. The patient is not going to be happy. And also, teeth have super erupted, we call it. Again, they're shifting to fill the gaps. So putting a denture up there is going to be hard because that lower tooth projects too much now. So that has to be adjusted. And just filing down the teeth is not always the answer. And this is a schematic of atrophy. You could see the drawing on the schematic on the right. It's a full face. It's a full face. Teeth do that. An open jaw. You can see the vertical dimension, the difference between the upper and lower jaw. As teeth are lost in the middle, the face starts caving in. And the jaw now looks compressed a little bit. And obviously the last one on the left is a jaw that has atrophy. The person has most likely no teeth or very, very few teeth. And the whole face has sunken in. And this, of course, you can see the images, which are similar to the schematic that I just showed you. But here I just want to show you when a tooth is lost, how Mother Nature naturally tries to fill the space. The teeth adjacent to it tilt either forward, tilt backwards, creating other gaps. Now you're going to get food stuck in that area, which you never had before. And even the opposing tooth is drifted downward to fill the gap.
牙周炎、牙根腐烂，甚至掉牙，这些老年人常见的牙齿疾病呢，确实给我们老年人带来了很多的烦恼。希望我们的观众呢，能从节目中呢多了解这方面的知识。牙周病是可以预防的，所以我们还是要从预防着手，尽量避免牙周疾病才是最好的选择。好，感谢收看今天的节目。在下期节目中呢，我们将继续关注老年人的口腔健康。我们下期节目再见。